Now we're going to bring to the stage Edna Cortez, an RN, chair of the Washington State Nurses Association.
Yay!
Thank you. Hello, everyone. Thank you, and what an honor and a pleasure to stand among all of you. I want to, on behalf of the nurses, thank you so much for being advocates. It is on behalf of a lot of the nurses in Washington. Thank you so much. Thank you again. Yes, I am a nurse. I'm a proud union nurse with the Washington State Nurses Association, and I am a pediatric nurse at Seattle Children's Hospital. And you know, we talk about universal health care. Guess what? It is for every age, from newborns to the elderly. And I see it a lot, especially with a lot of my kiddos at work. When I see, it's not just the patients that we take care of, it is their families, it is their parents, it is their siblings, it is whoever is taking care of them. It is a holistic, it should be a holistic, universal health care. It is not just for an individual, it is for the whole family. And how do our patients get taken care of? By their families. So we need to take care of them as well. The vulnerable, the pediatric, my kiddos should not have to work, should not have to have their parents, their guardians, their healthcare professionals worry of who's going to pay for their insurance. How are they going to pay for this? How are they going to pay for the surgeries? I have seen, and I'll give you an example. I had a kiddo who, they live all the way down south, past almost Vancouver, but they could not find a good health care. They had to travel up here, but they can only travel, this poor little pumpkin can only travel with his mother. So his family stayed down there because they could not find anything down south. That's shameful. That's shameful. No matter what age we are, we should find universal health care. Shame. At WSNA, we believe that everyone should have access to safe, equitable, and quality health care. You know, Karen talked about, I'm lucky, as a union member, I'm lucky to have health care. My father, while he was dying, was lucky to have health care and Medicare and Medicaid. But unfortunately, there's so many of our communities that do not have health care. And when families have to decide whether to water down formula, not get medications, but rather have food or pay the rent. Shame on our elected professionals that decided for us. And then we decide who is elected. Shame.
Yep.
So we stand at WSNA, the nurses, we stand with all of you in this fight. And again, what an honor. I stand with all of you who are advocates. Thank you so much. I am just beginning to exude my voice. It's just but David said, oh, when I met you last year, you were pretty vocal. And I was like, oh, trust me, that's nothing. But for this, I believe in this, and I believe in all of you. And I thank you all. But some examples. So in 2022, we supported the passing resolution at the Washington State Labor Council Convention seeking to achieve universal health care. But unfortunately, during this year's legislative session, we signed in support and sent legislators to legislators advocating for the passage of 8006. During this year's legislative session, WSNA also actively engaged in the support of Senate Bill 5241 to keep our CARE Act as part of the legislative agenda. Fortunately, this bill did not make it out of legislation this year. Oh no, shame.
Shame.
It did, however, make progress in the last few years in front of legislators. It would have brought the Attorney General's office into mergers and acquisitions process to provide oversight, compliance, and enforcement power to ensure health equity consolidations would not negatively impact access to services, as we've seen happen. This bill made it out of the Senate this year for the first time, but unfortunately got held up in the House and died. I know. What the hell? Oh, excuse me. But you know, some of my patients have said the words worse.
Yeah.
So they're the ones that taught me. So this is not going to stop us, though. We at WSNA and everyone here, I'm so proud, will continue to work and hold these hospitals accountable. Like I said in the beginning, it is every age, from the little preemies that I take care of or help take care of, and their parents, to all of us, to all patients. We put our patients first and their families first. And we also put safe staffing first.
Yeah.
Putting profits before quality care is not what we're about. We are not going to sit back and allow this to happen. It is my honor and privilege. Thank you so much for allowing me to speak. Thank you again.
Go nurses! Woo!
One more time for Edna.